to Dr. DeBeer and ask Dr. DeBeer to tell us a little bit about herself and why she's was brought to this work. Let's see, are you? There you are. Sorry, I couldn't see there. So hi, Bryann, if you can go ahead and then let me know when to move your slides forward. I'll go ahead and do that.
Sure. And I'd also like to thank Daniel for his discussion. So I'm Dr. Bryann DeBeer, and so I think that I come to this work from a different, perspective. So I have had a veteran family member that we lost to suicide via firearm. And I also lost one of my friends in Iraq. He was killed by an IED. And so, I was in graduate school at the time. I never intended to make a career for myself within the VA. That wasn't something that was on my radar. But after losing my friend, I really thought about, at the time, this was, 15 years ago, and people were saying, why do all these veterans have PTSD? Why are all these veterans dying by suicide? And I thought it's pretty obvious to me why. But we don't have enough research on that. And so I thought, maybe if I have the opportunity, maybe I should go into the VA and really continue to build an evidence base for this, to show that, repeated exposure to trauma does result in post-traumatic stress disorder. And I've always had a long-standing interest in social support. A lot of my undergraduate training, I went to New York University for undergraduate, was in something that's called social cognition. So how do we think about other people and conceptualize other people? And then when I was in graduate school, I continued on that path of social cognition and looking at things like likability and how do overt mental health symptoms impact likability. So when I came to the VA, I really wanted to take a lot of that work that I had done around social support and apply that to suicide risk in veterans, because we know that social support is a risk factor. But one of the huge limitations of the research that we've done in the past is that we don't have very good measures of social support. So we do a lot of work surrounding perceived social support. So that's where VNL comes in, because they have these really nice methods of social network analysis that are accessible to researchers. And so I've really appreciated partnering with them to better understand how social support networks impact veteran mental health and suicide risk. And so when the COVID pandemic occurred, we had a lot of concerns about how that would impact veterans. And so I emailed Danielle and said, hey, can you help me put in a grant proposal in 2 days and so we can try to get some funding to study veteran social networks during the COVID pandemic? And Danielle and her team said, of course, and we made it happen. So you can go ahead and advance my slide. I know that I have pretty limited time here, so this is a larger study, and I could talk about the study for 2 hours and explain all the methods, and I'm happy to do that with anybody who wants to hear about it. But I just thought that I'd highlight some of the results, and also just want to say a big thank you to VNL and their team. Especially shout outs to Sarah Sprong and Rose Hardy for getting this all done, and obviously Danielle as well. They're an amazing team to work with, and just really appreciate them. So this is PARTNERme data. And what we see here are newly identified pressing concerns. So we did this survey in about November 2020 through January 2020. So when the very first vaccine rollouts were occurring, before the vaccine was widely available. And what we found, these are increases in needs between the start of the pandemic and to that time in late 2020, early 2021. And so we see these pretty big jumps in needs surrounding healthcare. We were also really fortunate to get access to a database of veterans who had a positive COVID-19 diagnosis. So we were able to oversample for being positive for COVID-19. So we see this jump in healthcare needs, finances, mental health, behavioral health, emergency needs. So we see these big, pretty big jumps in needs since the start of the pandemic. Next slide. But what we don't see is we don't see that veterans have an adequate social network surrounding them in order to address these needs. That's something that we didn't know before this research, and we're working on publishing this now. And I think that that's really important because when we think about suicide risk, suicide is a very complicated phenomenon that arises typically from multiple issues that are occurring. And some of those issues are things like finances or lack of access to healthcare. And what we're seeing here is that when a need arises for a veteran, most of them don't have anybody in their social network that they feel like they can turn to address their needs. So 90% of people said that they didn't have anybody to help them with transportation. 70% said they didn't have anybody to help them with emergency needs. 70% also said they didn't have anybody to help them with healthcare. 65% for mental and behavioral health, and 69% for food. So these were just some of our top things that we saw. So I think that these findings are really very, very important because we need to start thinking about how we're going to support veterans accessing these needs. And I don't think that we're doing the most optimal job of that right now. What we're also finding is that these things are contributing to suicide risk as well. So this was a really nice way to try to understand the finer grained details of what is occurring in veteran social support networks, and use that information to find some concrete solutions to supporting veterans. Next slide. I did want to just put up some general resources, the Veterans Crisis Line. A lot of people ask me, like, I know a veteran, or I'm a veteran and I need mental health help. The easiest way to do that is to make an appointment with your primary care and ask them for that appointment, and they will put that appointment in. If you're a family member or a friend and you want to know more about getting your veteran help with the VA, you can call Coaching into Care, and they'll be able to help you navigate that. And the phone number is there. Next slide. If you're an organization and you're trying to connect with the VA, I highly recommend finding your facility's local recovery coordinator, as they do community-based work, as well as the suicide prevention coordinator. The VA is also rolling out right now community engagement and partnership coordinators, which will have a bigger role in going out into the community. A lot of, some veterans aren't eligible for VA care. That's something I could talk about for 10 hours. Feel free to, send me a chat or something if you have questions about that. Some veterans are not eligible for VA care. That is set by Congress. That is not set by the VA, and we just have to do what Congress tells us to do. So if you have a problem with that, feel free to call your congressperson or senator. If a veteran's not eligible for VA, I highly recommend sourcing community resources. We've been able to do that in the Denver metro and Colorado Springs area. And I'm also always happy to chat with anybody else about any of this. So thank you so much for your time. Really appreciate speaking with you all today. Thanks to VNL.
I am so sorry. I couldn't get my unmute to work. Tears, and I have not figured it out. Thank you, Dr. DeBeer. You can imagine there is a whole portfolio of work that she is leading and working on. And it has been such a privilege to get to be a part of the work that you do.